Of the 365 that received a person from this March 25th guidance, which was then superseded in May, 98% of those 365 already had COVID in their facility. COVID did not get into the nursing homes by people coming from hospitals. COVID got into the nursing homes by staff walking into the nursing home when we didn't even know we had COVID. Staff walking into a nursing home even though they were asymptomatic, because the national experts all told us you could only spread COVID if you had symptoms. And they were wrong. COVID may have been brought into a nursing home because visitors brought it in and didn't know they were contagious, because the guidance was you can only be contagious if you have symptoms, if you're sneezing, if you're coughing. That turned out to be wrong. That's how COVID got into the nursing homes. 98% of the people who took a person back from a hospital who was probably no longer contagious already had it in the facility. And they signed and agreed that they could handle it because they already had people who were COVID in the nursing home. If you look at the rate of death before the March 25th order and after the order was rescinded, the rate of death is the same. By the way, if you look at the rate of death in the nursing homes, in the spring overall, and in the second surge, the winter-fall surge, the rate of death is the same. These decisions are not political decisions. They're all made on the best information the medical professionals have at the time. And in New York, we talk to the best experts on the globe. And I've said to the people of the state many times, nobody's been here before. Nobody knows for sure. COVID is new. They're all giving you their best advice at the time. And these are really quality people. Dr. Osterholm, Dr. Fauci, all the main institutes that were giving advice to the nation. We had people come from the World Health Organization who dealt with China, who came to Albany, literally, to advise us. We're blessed to have Dr. Howard Zucker as our health commissioner. He's trained at Harvard, UPenn, Johns Hopkins, served at HHS, WHO, NIH. He teaches at Columbia and Yale University. If we had to pay him what he was worth, we couldn't afford it. And he gave his best advice on the information that he had at the time. I would trust Dr. Zucker with my mother's care. That's why I trust him with your mother's care. I wouldn't have anyone as the health commissioner who I wouldn't trust with my mother. And that's why I trust him with your mother. To be clear, all the deaths in the nursing homes and in the hospitals were always fully, publicly, and accurately reported. The numbers were the numbers, always. People did request information beyond the place of death, not just how many in a nursing home, not just how many in a hospital. They did request different categorizations beyond those counts. How many people died who were in a nursing home but then went to a hospital? How many people died who were in a hospital but then went back to a nursing home? How do you count presumed COVID deaths? Everyone was busy. Everybody was here every day. We're in the midst of managing a pandemic. There was a delay in providing the press and the public all that additional information. there was a delay. What did we learn from this entire situation? What are we still learning? There are hospitals that perform well, and there are hospitals that performed less well. We still see hospitals performing less well. When you look at those vaccination numbers, hospitals with the same demographics of workforce in the same region, with different vaccination rates of their staff, that's indicia of performance of those hospitals. There are nursing homes that performed well, and there are nursing homes that did not perform as well. We have to learn from it, and we have to correct it before we have another surge and another pandemic. And by the way, we are going to have another pandemic. As I sit here, I would plan on it. And yes, this was never seen before. And yes, hospitals had to deal with something they never had seen before. And yes, nursing homes had to deal with something they had never seen before. But they will see it again. And now we have to learn from it before it happens again. Our focus, I believe, is going to be on the for-profit nursing homes. Hospitals, low-performing hospitals, but also in the for-profit nursing homes. I have long believed that there's a tension in a for-profit nursing home because those institutions are trying to make money. If you're trying to make profit, it's too easy to sacrifice patient care. Everything becomes one or the other. Do you want to hire more staff, or do you want to make more profit? Do you want to buy more PPE and stockpile more PPE, or do you want to make more profit? Do you want to buy new equipment, new beds, new sheets, new furniture, invest in the facility, or do you want to make more profit? That tension is a problem. And that has to be resolved legislatively, because I don't want to leave it to these for-profit owners to decide what's right, what's wrong. Let's learn these lessons. We have to implement hospital reform and nursing reform, and we have to do it in this budget cycle. COVID isn't done with us. Implement the lessons now, and we're going to propose them in the 30-day amendments. If you're a for-profit nursing home, I believe it should be mandated how much you put back into the facility and how much profit you can make. I believe that. Nursing home hospitals that have these issues, they have to improve, and we have to take it into consideration when there's a surge. If there's an influx into hospitals, not all hospitals can handle it equally. And that's why you saw some hospitals fail. If you could do it all over again, just rewind the tape. I understand the public had many questions and concerns, and the press had many questions about nursing homes primarily. And I understand that they were not answered quickly enough. And they should have been prioritized and prioritize those requests sooner. I believe that. I understand the reasons. I understand that there was a lot going on. Everybody was working 24 hours a day. Everybody was overwhelmed. We were in the midst of dealing with a pandemic and trying to save lives. They were answering DOJ. And nursing homes and the hospitals were also in the middle of hell and the middle of a pandemic. And they were scrambling, and they were managing the crisis. I understand all of that. But the void we created by not providing information was filled with skepticism and cynicism and conspiracy theories, which furthered the confusion. Nature abhors a vacuum. So does the political system. You don't provide information, something will provide the information. Most of all, The void we created allowed disinformation, and that created more anxieties for the families of loved ones. I've had hundreds of conversations. People couldn't get into the facility to see their loved one. They couldn't get them on the phone. They couldn't get staff on the phone to get answers. They were powerless. They were helpless. They were literally physically removed and isolated. Loved ones died alone. Loved ones died alone. Fathers, mothers, brothers, sisters died alone. It was horrific. It was horrific. And then the void in information that we created started misinformation, disinformation, conspiracy theories, and now people have to hear that. And they don't know what is the truth. The truth is everybody did everything they could. The truth is you had the best medical professionals and advice on the globe. The truth is it was in the middle of a terrible pandemic. The truth is COVID attacks senior citizens. The truth is, with all we know, people still die in nursing homes today. People still die every day. We're testing the staff twice a week. There's no visitation. People still die. You would have to hermetically seal a nursing home. They actually tried this in France, where the staff lived in the nursing home. Anybody can bring it in. A delivery man brings it in. The heating repairman brings it in. Staff person goes home, meets with their family, someone in the family has it, staff member comes back, the staff member brings it in. Even when you're testing twice a week, you'll get people who have it and you'll miss them in the twice a week. That is the reality. But not providing the information creates the void. The void allowed misinformation.
Hi, Emma Reckenberg here. If you like this video, there's a whole lot more to see on Newsmax TV. You can watch for free right here on our YouTube live stream and be the first one here each time our experts break down real news. Just hit that subscribe button, ring the bell icon, and stay with us on America's fastest growing cable news channel, Newsmax TV.